Hello, good morning and welcome to our latest session as part of Insight 2020, a festival of analysis and learning in health and care. Over the course of 6 weeks, we're hosting a series of virtual events exploring some of the challenges facing analysts and decision makers in health and care in 2020 and beyond. A few weeks ago, as part of the festival, we introduced the concept of a regional decision support centre in the Midlands to support the establishment of local decision support units, or DSUs, across all of our local health and care systems. And today's session focuses in more detail on one of the regional decision support centres' key work streams, its education and development programme. So my name's Gareth Wrench, and I'm a programme consultant with the strategy unit, and I'm the host for this morning. In terms of speakers for the session, I'm joined by 4 strategy unit colleagues who will each talk in turn about various aspects of the Decision Support Centre's education and development programme. So in terms of the batting order for the session, we'll kick off with Mohammed, who's a principal consultant and also the training lead. And he'll provide a bit of background to the programme and some of its underlying design principles. We'll then move on to Rachel, who'll talk a bit about our analytical huddles and some of our planned action learning sets as part of the programme. We'll then move on to Mike, who'll talk about one of the action learning sets in detail around system dynamics modelling. And then we'll finish with Lucy Hawkins, who'll talk a little bit about the work we're doing around analytical leadership. So just before I hand over, just a few house rules. So please keep your microphone muted during the session. And please do introduce yourselves within the chat box, say hi and let us know who you are and where you work. Please do feel free to use the chat box function to ask any questions throughout the session, which we'll come back to at various points and at the end of the session, and also to raise any particular technical issues that you might have. Just to let everyone know that sessions are being recorded and the links will be sent to registered participants following the session. If you're on Twitter, please do feel free to tweet about the sessions using the hashtag Insight2020, and you can also tweet us at strategy_unit. We're going to be using Mentimeter just initially, just to find out who we've got within the room. So at this point, if you could please go on to www.menti.com and please use the 7-digit code there, so 6322862, or you can also use the QR code reader on the right if you've got a QR reader on your phone. You can do it either within your mobile or you can open up another browser window. So I'll just give you a moment or two just to go on to Mentimeter and to register. I'll just pick up the Mentimeter content. I can see a few of you already in and you've already voted, which is great. The first question was, how would you describe your job role? So obviously you're expecting a reasonable proportion of analysts within this session. But if you could just tell us, whether you see yourselves as more of a junior analyst, whether you're maybe a bit more senior within your organisation, whether you're an intelligence or analytics lead who is responsible for a team of analysts within your organisation, or if you've got another type of role. You can see we've got about 17 participants on the call. I'll just give colleagues just a moment just to get in and just vote on that if they want to. It's just to give us a feel of who's on the session this morning. So we've got a fairly sort of broad spread across each of those different categories, which is great. Okay, I'll just move it on to the next question now. And this was just a question around just finding out which type of organisation you currently work for. So whether it's an NHS trust, clinical commissioning group, maybe a commissioning support unit, or if you're based within a local authority, or whether you work for NHS England, Improvement, or Public Health England, or any other type of organisation. Just again give you a moment there. One local authority colleague, a little bit of a contingent from commissioning support units, a few based within trusts, and a few from other organisations. I'll just give us a feel of who we're talking to. So it's a fairly sort of fairly reasonable distribution. Okay. And this was an open-ended question that we just wanted to ask, just to find out about your own sort of personal training needs. So what would you consider to be the key current training needs for each of yourselves at this sort of point in time? This can be anything in terms of very technical training needs. It could be something around sort of softer skills. So very much sort of open-ended at this point. Just to get your own perspectives on things. I'll just give you a moment just to reflect on there. We've got a couple coming in. Again, we've got things like population health management, obviously very broad, and then obviously more technical expertise around sort of data science techniques. Obviously, the use and application of R. Again, some other quite sort of technical data science components of things like machine learning, the use of GitHub. Probably worthwhile just giving a plug for our session later this afternoon, which is a crossover section with the NHS-R conference, which is all about finding out a bit more about R. So starting from scratch. So if you are interested, that session's on, I think, at 2:30 this afternoon. And then we've got other sort of technical aspects around, sort of web-facing tools, around data visualization, and the use of geographic information systems, mapping spatial data. We've got other colleagues here interested in Python. And then another one there around, more effective ways to structure decision making. So it draws effectively upon analysis in its broader sense. So drawing upon some of those sort of softer analytical skills. There's something on system dynamics as well, which obviously Mike will cover within his session. Okay, that's really helpful. We'll just dip out of there and then back into the slide content. And at this point, I'll hand over to Mohammed to take you through an introduction to the Education and Development Programme. Over to you, Mohammed.
Thank you, Gareth, and a warm welcome to all our colleagues who've joined the call. That was really interesting to see some of that feedback, by the way. For those of you that are relatively new to R, I would kind of encourage you to join the NHSR community. So if you go onto the internet, have a look for the NHSR community, and then contact us through the contact form. There's lots of training and development opportunities in R through the community. Today's not about R, by the way, so I will kind of refocus now. So next slide, please, Gareth, thank you. So really, this is meant to summarize in this kind of schematic, really, that our decision makers have lots of things to puzzle them, lots of problems and issues that they're mulling over, thinking about. And in all of those cases, they have to try and make some sort of decision, really. From thinking about a problem and then arriving at a decision. So I'm not saying that's a trivial task by any means, but that's the essence of what leadership is about. At least one key component is about making decisions. Next slide, please. So what the aim of both the decision support unit is, and also therefore the training and development function, is really to bring analytics to the heart of the decision-making process. The idea is that we want to enhance the quality of the decisions that decision makers make. And by analytics, we don't mean necessarily quantitative data alone. It's really bringing together a whole suite of things which you might describe as analytics, which would include a non-quantitative evidence and non-quantitative data as well. So really, in a nutshell, this is what we would like our DSUs to achieve, and analysts and analytics would be at the heart of that. Next slide, please. So some of you will be aware of the background to this. The Health Foundation produced a report some time ago now, which identified the untapped potential of analytics in healthcare. And so the strategy unit is working hard really to try and address the challenges that we have to overcome to get analytics to be at the core of decision making. So through the decision support units across the Midlands, our role is the development centre, and we're therefore designing a series of development programs across the region, and your voice and your contribution to that is enormously valuable. That's why the things you've just told us about your training needs, I think, are important to help inform our development. But we also recognize that this is not kind of traditional kind of courses in academia, that actually the analyst training program must strike a balance really between rigor and the pragmatism that's required in the real world. And you may even describe that as being the kind of the wisdom of practitioners, really. So there are some aspects to the training program which are rooted in really where analysts are at the moment. Next slide, please. So just some design principles. These are not comprehensive, but just some critical ones. We recognize that decision making can be complex. So this is by no means underestimating the challenge that is faced by decision makers at any level of an organization or a system. We also recognize, therefore, that the associated analytics can also be complex. And there are many analytical techniques, both quantitative and qualitative, and analysts will need time to support. It will need support to learn and apply these techniques, and these techniques also require the knowledge of what you might describe as softer skills that are kind of part of the toolbox of an analyst's kind of kit, really. Some of the other design principles we're responsible for creating very safe, by safe I mean psychologically safe learning spaces, so people enjoy the learning process. They are not frightened to ask questions or kind of appear like they're new to something. We will work very hard to make sure that the learning opportunities feel very comfortable and safe. They will be rooted in the real world. And we will use a range of learning opportunities, as you'll see. One of the key things we'll try and do is try and emphasize the learning by doing. Wherever possible, we will rely on open source approaches where we can share and support across the network. So there is no sense of kind of closed solutions which cannot be shared. In fact, the design principle is exactly the opposite. Everything will be assumed to be open source and shareable as a default position, really. We recognize that we're also trying to expand, and of course this is developmental. I think this is perhaps the first time this has been done, at least to my knowledge, and so there will be things which kind of land okay, but there will be things that we need to kind of enhance and improve, and your contribution to that, really, your voice to that will be very important to us. Next slide, please. So just to give you a quick overview of what's on the menu. We've got huddles and webinars, which Rachel will talk about in a short while. We've got a few action learning sets. There are five in total, but we'll talk about 2 of them today, but you'll see what's in the pipeline. And we also think there is a need to kind of have what you might call tutorial classes or master classes. We have already got some content around this, and we're trying to just work out a way to include it in the rhythm of the curriculum, really find a space for it so that it kind of lands and is clear. But so our menu items are these three at the moment, but if people have other suggestions, you know, we would be very keen to hear about them. Next slide, please. I think I'll hand over to Rachel now, if I may.
Hi everyone, just as I was taking a drink. Thanks, Mohammed. Right, yeah, I'm just going to say a bit more about the Midlands Analyst Network, or MAN for short. The network was created to provide a space for analysts to share information, ideas and resources, as well as to seek advice and guidance from one another. And we've over 300 members at the moment, and these members range from all sorts of organisations across the Midlands mainly, but also NHSEI and others. And they cover a wide range of skills as well, and of experience and knowledge. So there's a really good a good mix of people and skills on the network at the moment. And if you'd like to join, actually, please do contact me directly, and somebody will at this point hopefully put my email in the chat box. If not, I'll do it in a sec. And we have a Teams channel as well for the network, and this is actively managed by a multidisciplinary project team and input too from the strategy unit analysts. And of course, we hold fortnightly huddles. These last an hour each, and we get between 50 and 100 participants each time. Like most people quite enjoy these huddles. In that huddles, we cover a wide range of topics, and we aim to make them as interesting and as engaging as we can. And so we like to try and vary the format of them as well. So I'll say a bit more about what topics we cover in a minute. And but also we have members from the strategy unit senior team, we have guest speakers, and we share work, analytical approaches, insights, and we have with participants in the huddles. So just looking, if you can go to the next slide, we are on the next slide, that's brilliant. So here are some examples of what we've covered in the huddle so far. And I won't go into all of these in detail, but we do try to have regular updates of participants' work, projects, learning opportunities and requests for help, etc. This is what the huddles are about. This is what the network is about. We had some, inevitably, we've had a lot of content around COVID-19. So we had some really interesting talks about the early warning systems, and the alert dashboard, which was shared by Nottingham, I can't say it, CCG, that one. And we had a really interesting model about demand and capacity modelling for COVID as well. And we've also had Mike Woodall, who's going to be talking about system dynamics action learning set in a minute. He was talking about the model that has been developed for the waiting list. And we had Public Health England colleagues talking about the skills mapping exercise and the analytical network force development around that too. And then we've had quite a lot of content from the national perspective, which has been really useful. We had an excellent presentation from Charles Tallock about the excess deaths around COVID. We've had talks around artificial intelligence, and we've had Kate Chima here once or twice, and I think she's here in the festival 2 or 3 times when she's supporting us with our discussions around the value of analysis, working and decision makers, and becoming an analytical leader. And more recently, we saw a really interesting presentation on the COVID-19 early warning system forecast explainability tool. It's one of those ones you had to be there. Some of these are a bit of a mouthful, I do get that. And we've had international presence as well. We had some fantastic presentations and information sharing from colleagues in Texas. I remember well that they had to get up approximately 4 a.m. to be with us that day. And we've had dynamic causal modelling explained to us by Professor Carl Friston, and that was a really engaging and useful discussion as well. And we've got plenty more planned, but we are always looking for people to share their work too. So it isn't, I think it's quite important to say, it isn't just about sort of getting people from national, international perspectives. We find these very useful. I think they can be very motivational and inspiring, but we really do want to engage with network members and provide an environment which is useful for you to help you in your day-to-day work. Okay, so we could just move on to the just a summary of the action learning sets that we've got planned for the next year. Mike's going to be talking a bit more about the system dynamics action learning set in a minute, which has already started. We had our first session yesterday, and Lucy's going to be talking about the leadership development for analyst action learning set after that. We've also got planned action learning sets again around quasi-experimental design, that's starting next year, machine learning techniques, and how to develop and support population health management. So on that, I'm going to hand over, I think, to Mike, who's going to tell us about system dynamics action learning set.
Hi everyone, I'm Mike Woodall from the Strategy Unit, and I'm leading an action learning set on system dynamics modelling. So as Rachel said, excitingly this started yesterday. So we've had our first session and I think it went well, but I'll talk you through what we're doing and how this fits back into the ethos that Mohammed described at the beginning, and how, you know, this is the start of a journey. We're looking at how action learning sets can be applied, as well as actually specifically about what we're doing within this action learning set. And what we're trying to do is build skills that are transferable. So what we're trying to do is build skills within the people on the action learning set that they can then pass on to colleagues in the future. But anyway, to system dynamics and why this is important. So it's a way of thinking about whole systems or whole organizations and looking at the interactions within those. And it's very data driven. So what you can do is build models, and then the method we're applying allows us to build models quite quickly. So we can start with smaller elements of the system and build out from there. And then what you do is you can drive that with data. So what you can do is then calibrate your model with the past. So you can say, okay, then how does my system work and how does the data show that works? And then once you've done that, you can then start to say, okay, then what happens if any of that changes in the future? What are our assumptions about that? And how can we model that forward? So for example, a very simple map might look at admissions, how admissions and discharges impact on the number of inpatients in a hospital. So you can look at, so what it uses is a thing called stocks and flows. So the stocks will be the number of people in an inpatient bed. So if you take it as something like a room, if you've got a room with people in it, so you might start with 3 people in it, and then as people come in, so you might have another 2 people come in, so you've got 5 within your room, so that's your stocks gone up to 5. But you might also have had 3 people leave within that period of time, so that leaves you with 2 people within your stock. So you can start to see how you can kind of look at the flows through systems, and what you can start to do is adjust those flows in and out of your stocks to see how they're affected, and you can build multiple stocks across multiple different kind of objectives to do that. So we go to the next slide, please, Gareth. It's an approach to understanding non-linear behavior of complex systems over time. So you use stocks and flows. It also has internal feedback loops, so you can ensure that things kind of are flowing correctly, and you can use things like time delay. So where something might happen at one period of time, but the impact, it doesn't happen until the future, you can build those into your models. They show how systems interact with one another. Importantly, they use aggregate data, so we're not looking at the flows of individuals, we're looking at the flows of groups. So rather than seeing what happens to an individual as they move into the system and move out, what we're taking is aggregate level data and looking at how they flow through systems. So it works really well at whole system level. There may be issues if you want to look at individual kind of flow across a hospital. You might want to look at other methods, but it does really help. But in terms of how you can kind of look at flows within systems, and we've had a look at it for waiting list models. So looking at how waiting lists have interacted over time, and it works really well with those types of problems. And what you're really doing is building a model, validating it against real life data, and then using it to help simulate the impact of changes in kind of policy or intervention. So what happens if referrals into the system increase? What happens if you change your policy in terms of the number of people you can see within the system? So if you increase the resources within a system, and therefore you can increase the number of people who have an inpatient stay, what impact does that have on overall numbers on, let's say, your waiting lists? And as we've seen before, they're shown as stock and flow diagrams. So the stocks are these accumulations that sit in the middle that are only impacted by what their inflows and their outflows. So the stock will always be the number in the stock plus what's been added as an inflow minus what's come out as an outflow. But those inflows and outflows can be affected by a number of things, including kind of variables that you can set within the model. So that's broadly system dynamics modeling. So if we move on to the next slide. So the Action Learning Set is a 12-month development program. It started yesterday, as I said. So we've split the first session into 2 half-day sessions. So rather than trying to get people to stare at a computer for a day, we're doing it yesterday and tomorrow morning. We've got 25 analysts signed up to do that, and then we've got 5 decision makers to kind of come in at strategic points. So what we're trying to develop is not just the skills to run these system dynamics models and build them, but actually what do you need to develop the problem? So how do you need to interact with decision makers to actually specify the problems that they've done, to kind of interact with them about how the modeling works so that they understand at least how it's going to support those decisions, and also to have decision makers help in terms of how do we then present the results back to them in a way that's meaningful and allows them to make those decisions. So so that's a really important factor, and it goes back to kind of Mohammed's earlier point that these things are not about analytics in isolation. What they are about kind of building the skills to ensure that analytics drive decisions in a much more focused way that's both helpful to the analysts in order for them to build the right models, but also it is really important that they're good with good for decision makers. So we're doing this with Kim Warren at Strategy Dynamics Limited, who's got a lot of years of expertise in this. So he brings the kind of technical elements, and then what we're doing is focusing that on health problems. So he's got a long history of system dynamics modeling within kind of industry, and what we're trying to do is build up that so it's more specific to health. We're looking at a set of supporting skills, as I've said. So, you know, how do we effectively work with decision makers? We've got a monthly action learning set that sits beyond. So what we've got is a set of training, but also some practical elements of that. So what we want to do through this is build real life models that are based on real problems that people do. So what we end up with is models that people can use in the real term, so they can take them back to their organizations or their systems and actually apply them in real time. The monthly action learning sets now are going to be split into 2 half days. So we're going to do fortnightly work, and so fortnightly action learning sets of half a day rather than doing a full day. That's partly due to the kind of where we are at the moment, but also so we don't lose momentum. So people are kind of looking at this kind of constant, you know, they're not going away and waiting for a month before they're seen again. They're supported all the way through. Obviously, this is not a trivial commitment for participants. So the fact that they will get models that they can use in their system is really important. So yeah, as we said, there's 2 half-day sessions a month. And what we're doing is, so an initial set of training now, and what we'll do at each of the sessions is kind of allow people to report back on their models, the problems that they've had, the queries that they've got, and then add in additional elements of teaching. So we're building it up over time. So they're learning the kind of basics, and then they're kind of building up those skills over time while actually using those basics elements. And obviously at the moment we're doing all that online. That may change based on the future. We don't know. So at the moment we're kind of planning that it will all be online, but actually we might one day meet each other. Next slide, please, Gareth. So yeah, so we've got a set of objectives to help provide an understanding of how this can be applied within health and care. So there are some applications that have been developed, but they're not. Yeah, there are some applications that have been developed in health and care, but it's not widely used. So what we want to do is ensure that we're building use cases that people want, people need, and that those elements. We're gonna provide skills to people in kind of designing and developing these models, and that includes kind of working with key stakeholders to do that, and how they do that, how they work with them. We're looking at different software options. So we've paid for a kind of license tool to start us off, and we've provided licenses to all the participants, but we'll look at other elements and other open source options as we move through. We want to create capacity within local systems. So we've tried to find people in each of the different decision support units. We haven't been wholly successful in that, but we've got the majority covered at the moment. As part of that, we're developing a community of practice. So what we want is people to share their experience and knowledge around this of system dynamics in healthcare. We've also opened up the initial training to 1 or 2 other people who either expressed an interest or have got a national role within system dynamics. So that kind of expands our community of practice. As I've said kind of a number of times, but we are looking to build those supporting skills. So it will link a little bit with what Lucy talks about later in terms of the kind of leadership skills within that, but it's about kind of working with people to ensure we build models that are both useful and understandable and most importantly used in decision making. And finally, and this is a really important factor, what we're trying to kind of build is skills that analysts can then pass on to their colleagues. So what we're hoping for is to kind of build this train the trainer element within the action learning set, so that the skills you know, are replicated elsewhere. So we kind of build up skills in this area, and we support people to develop that training. And as part of that, what we're doing is recording our sessions so that they're available to other people. All the materials will be open for people who are not part of the action learning set to kind of use and go away and kind of learn themselves if they want to. So it's a very open way of developing and providing this training. Next slide, please, Gareth. So we've got our participants. They've been recruited. They've been through the first day of training. We gave priority to the Wave 1 DSU site. So that, I think we've got most of them represented within this, at least by one person, and sometimes more. Yeah, so we don't have we've got a broad definition of what an analyst or a decision maker will do, but broadly what we were looking for in terms of recruitment was no particular knowledge or skills in terms of what they had before they came on, but an interest in kind of building these models, and more importantly, an interest in then taking those away and using them and building them within the system and talking to people about doing that. We're still doing a little bit of our design work, but it's broadly done now. And we will be evaluating it and kind of developing it to help with the kind of future. Next slide, please, Gareth. So this is our kind of program. It will change. So part of the kind of program is that this is inclusive. So we will work to the kind of speed and kind of requirements of the group that we're working with. But as you can kind of see, there's a half day number 3 that includes system leaders. So what we'll be doing is providing some of the skills back to system leaders on system dynamics so that they know kind of what they want to ask for, what sorts of problems this can resolve, and have some understanding about how to interpret the outputs so that they can then start to kind of help design them in a way that's helpful for them. So next slide, please, Gareth. So in terms of participation, what we're doing is build them into smaller groups, and within those smaller groups, we've got a set of kind of initial problems to kind of provide to them. So the analysts will attend all sessions, and the decision makers will be brought in at times that make sense in terms of getting their perspectives. There's advice and guidance and challenge throughout, and a set of coaching that goes alongside this. So outside of the action learning set, if somebody goes away and kind of starts to build their own models or build on what we've done in the training, they'll have access to coaching and support through either webinars or email support, so they can kind of send in queries. They can set up individual sessions to do that. And we're not a formal training kind of provider, but we'll provide some sort of accreditation at the end to say that they've completed the course. So the final slide next just talks about the kind of benefits. So there's quite a lot of kind of benefits to the wider decision support network. So at first we will generate realistic simulation models that are relevant to NHS challenges. that can both be used individually by the participants within their own decision support unit, can be shared with a wider decision support network and beyond. So we'll make things as open as possible. They'll all be shared across the network, but they'll also be shared across the wider NHS. And again, all the materials will be available for people to use. We've got a set of case studies that we're building at the moment. So as I've said, these will be driven by participants. So these are our kind of initial ideas of what those initial models might show, but they might cover the impact of, let's say, the impact of COVID on emergency admissions, and what the future impact of kind of second and third waves might have on overall admissions to that, and also what the impact of things like delayed elective care might have on kind of emergency admission rates in the future. We'll look at things like community mental health activity. So we're not just looking at acute hospital. What we're looking at is a wider health and care system. So what the impacts on community mental health activity, how does that change over time? Another element we might look at initially is on cancer waiting time. So we know that elective care has been delayed, and trusts are starting to delay that elective care now, but what impact does that have on cancer waiting times? Are the people waiting in the community who've not been referred yet? How might that impact on the kind of performance measures around that? And then things around delayed transfers of care. So what's the impact on adult social care of delayed transfers of care? How does that support in terms of kind of reducing those levels? So yeah, and the models will be developed sufficiently to allow them to be applied by participants to their own health and care system, and also where possible, kind of released into the wider system with fully documented so people can run them themselves elsewhere. And finally, as we develop through this, we'll develop a kind of light touch version of the program that will be available online so that people who are not part of the action learning set can go away and develop these skills. So that's a kind of broad description of the system dynamics action learning set.
Okay, thanks, Mike. That's really helpful. Can I just quickly pick up a couple of questions with you in the chat box that have just come in?
Yeah, sure.
Just conscious of time, but if we could pick them up. So Zoe's made a good point. I think you touched upon it in your last sort of slide, in terms of thinking about the sort of wider health and care system. So Zoe just asked, yeah, are you looking at flows wider than just hospitals? So some of the impact of changes in hospitals may have negative effects earlier in the system. So within GPs, primary care, which are not currently picked up.
Yep. Yeah, so we're looking at whole system models and how they're impacted on that. So for example, we built a waiting list model that looks specifically at what happens to the kind of elective waiting list, but that makes assumptions about accumulations within the community and primary care of people who haven't been referred into the system at the moment. So it assumes that there's people being managed within primary care or are waiting at home and how they might flow through primary care. So the models will have that, and they will be driven by the people on the action learning set. I think it's being clear that actually the participants cover. We've got people from acute trusts, community trusts, mental health trusts, adult social care, public health. We've got somebody from Public Health England as well. So we've got a wide range of participants who will shape those problems and shape those case studies that we build. Yeah,
okay, no, that's great. Yeah, thanks, Mike. And there's just a comment from Richard Wilson as well, just in the chat, asking if you've been able to find, or whether you're aware of the old Simulate models from 2010 that I think Mike Davidge did, which looked at a sort of whole system model. So I think simulates a discrete event simulation tool. So it's just whether you're aware of that.
I'm not aware of those specific models. We do have skills within the unit and other elements that are looking at discrete event simulation. So we are kind of aware of that. They may help in terms of kind of problem definition, but the actual models will be slightly different because what they're looking about is how individuals flow through the system. So they simulate how an individual flows through the system, or multiple individuals, whereas what we're doing is we're taking those and grouping them and looking at flows of groups of people. So yeah, so I'll have a look back at those. I'm not aware of them at the moment.
Okay, no, that's great. Thanks, Mike. Okay, just conscious of time, so if we could just move on to Lucy just for the final section around analytical leadership development.
Yeah. Thanks, Gareth. So hello, everyone. My name's Lucy Hawkins. I'm a senior consultant at the strategy unit, and I'm going to talk to you about the leadership development programme for analysts. From the questions we asked you at the start, this clearly isn't really top of your development needs list, but I'm hoping to kind of make the case that we think it's really important, and just talk a bit about why we've chosen to focus on this as one of our action learning sets. So Gareth, if I could have the next slide, please. So the focus on leadership development for analysts has grown out of the previous work by the Health Foundation that Mohammed talked about, and also some work that we've done around the analyst revolution. So it's all very well doing all these clever things and doing all this analysis, but actually if it isn't used and if it isn't influencing policy and decision making, then kind of what's the point in doing it? But I won't say that too much. So a recent paper by Ben Goldacre and colleagues highlighted that we need to develop a 21st century NHS analyst workforce with a range of skills who can deliver innovative and efficient data analysis on questions relevant to clinicians, commissioners, patients and policymakers. And we see this as a bit of a call for actually getting analysts around the table, getting them out of the corners that they're often put in health and social care organisations, and getting them into the kind of public eye a bit more, able to demonstrate their skills and what they can do. And we think that in order to do that, there is a need to develop the negotiation skills, the influencing skills, problem structuring skills, just those sort of, we call them the softer skills that are actually going to be really effective in getting people into, getting the products that you're creating out there. We're not really aware of many other specific leadership development programs for analysts, and we think this is definitely a gap in development opportunities. I think a lot of people, at least a lot of people we've spoken to, end up in leadership roles because they've kind of fallen into it, or they've progressed up the analyst kind of career pathway and ended up as an analytical manager. But we're not just talking about people who've got manager in their title, we're talking about leadership at all levels of the organisation. So the aims of the programme are to develop the leadership skills of analysts. So in terms of when we're talking about leadership skills, we're specifically thinking about problem structuring, networking, communicating and influencing, but also coaching and mentoring of other people and creating networks within the analytical community. We want to build a sense of community amongst analytical leaders. I think we don't want people to feel like they're kind of manning the barricades by themselves and kind of making the case on their own. We want people to be sharing. And as Mike said, actually, we're really keen to create, and Rachel as well, through the networks, we're keen to create communities of practice to network analysts, because we believe that through that, actually, we can be sharing new techniques, we can be sharing findings, we can, just be improving analysis and the work that we do. And we also feel that through that as well, we can have a better reach for the work that we're doing, and therefore get it into the hands of decision makers and the people who are actually kind of going to be using it. We want to talk about actually the role that analysts have in decision making, and again making this case for getting analysts at the table, and how can you work alongside decision makers rather than just being asked to do something and then not really knowing where it goes or what happens to it, but actually shaping the questions that are being asked, and actually shaping what happens with the outputs of your analysis. And finally, just thinking about actually how can we enhance the skills of analysts, and how can we continue to develop analytical capabilities across the system. We've said we're aiming the programme at senior analysts and team leaders, but I think that's probably not exclusive. We just thought in terms of this agenda, that was a good starting point in raising awareness of leadership skills and how we can start to bolster that. So that's why we've started there. But if you're interested and you wouldn't see yourself as that, please do get in touch with us anyway, because we'd definitely be happy to have a chat with you. Next slide. So just in terms of what we're going to be covering in the programme. So the first 3 sessions focused on kind of the more traditional leadership kind of qualities. So we'll be thinking about actually what is the role of analytics and analytical leadership in health and care. Actually, how do analysts make a difference? We'll be thinking about the unique position that you guys have as kind of experts in your field, and actually we often think about needing to engage clinicians or other health and care professionals because of their expertise, but also recognising the expertise of analysts and actually almost the power that gives you to influence things, and the ability that you have to actually use your skills and to get them out there and to be a broker and a networker and an influencer in that system. We'll then be thinking about actually leading analytical teams. So actually, a thing that naively I hadn't realised, I think, until recently, and I'll put my hand up to that, is actually all the different analytical skills. So actually there isn't just one analyst and a model that everyone fits. Actually, there's such a variety of skills. And so we'll be thinking about how do you create a really strong analytical team? How do you develop your team? How do you develop the skills of individuals? How do you promote that development and push them to enhance their skills and to learn, and obviously through that we'll be linking to things like AFA and the NHSR network, and those are both really important organisations and work going on there in terms of actually developing skills and networking and building those teams. We'll then move on to think about systems, and again this will be thinking about actually the analyst's unique place in the system. I think there's been a bit of a debate in our team about analytical ability to work with ambiguity, and some people think that analysts just like everything to be clear and ordered, whereas others actually say that you're in a really unique position in terms of problem solving and structuring and actually understanding the complexity of the systems that we work with. So we'll be having some good fun in playing around with that and thinking about actually what that means. And then we'll move on to the slightly more technical things for the last 3 sessions. So we'll be thinking about decision quality and how you as analytical leaders can support decision quality and the processes around that. And I think somebody said that earlier, actually, how do we better structure decision making? So that's where that will really come in, and how can you feed into that and influence that process, the decision making process. We'll then go on to what we're calling the analytical toolkit, which will be thinking about actually how do we structure problems, how do you manage an analytical project, how do you communicate your results, and potentially, if we've got time and space, we'll be thinking about a bit about the science of improvement in that session as well. Before finally ending on a session on futures thinking. So actually, how do you support decision making for the long term and influence decisions that aren't just thinking about tomorrow or the day after, but thinking about the next 5, 10, 15 years. So that, I think, is it from me. There's practicalities. So we're starting, as I think we said earlier, we're starting the programme in January. There's 6 sessions. We are going for full day sessions. So, but please don't be daunted by that. We are going to try and make it as friendly as possible in the current climate. I think we were hoping that we might be able to do some face-to-face, but I think, as we all know, that's looking unlikely. If you'd like more information, and if you'd like to know how to apply, please just email the strategy unit email address, which is there, and we'll be sending out a bit more information shortly, which will have more details on the sessions and kind of who we're looking for. So thank you very much. That's me. So yeah, if you've got any questions, I'll put my email in the chat box as well, and yeah, do get in touch with me directly. So thank you very much.
Thanks, Lucy. That's great. Okay, we're just coming up to the close of the session now. So just wanted to obviously thank all our speakers for today. So thanks to Mohammed, Rachel, Mike and Lucy. Yeah, just for giving us that sort of run through in terms of the education and training programme. So big thanks to them. I just wanted to give you a quick reminder of what else we've got coming up this week that might be of interest. So later this afternoon, I did mention earlier, but a lot of sort of interest in the use of R. So we've got this crossover event around the importance of R that would be worthwhile joining if you're interested. And then again, following on from that, later this afternoon, we've also got the NHS as an anchor institution. so sharing experiences and shaping decisions, where we've got some colleagues from the Health Foundation leading that session. Then on Thursday tomorrow, we've got something around trying to make sense of the ever-changing and emerging COVID evidence base. So something quite topical there if folks are interested. And then we're finishing off the week on Friday with an introduction to decision quality, again, which looks really interesting, and it will be led by Mohammed. And if you are interested, yeah, you can register at the address there. But I think that's all I wanted to say at this stage. I don't think there's any other questions in the chat, but if anyone does want any more detail, then please do feel free to get in contact with us. I'll give you 4 minutes of your time back so you can go and make a cup of tea before your 11 o'clock meetings. And yeah, thanks and goodbye.
Thanks very much. Gareth, should we hang on for a few minutes then?
Yeah, no, absolutely.
Great. I think that there's another Zoom call at 11. So
yeah, we've got the team meeting.
Yeah, so we only need a minute or so and then we're done, I think.
Yeah, I'll just stop the recording before I forget.